We're very excited to be presenting new data at the annual scientific meeting of the American Society of Clinical Oncology. We've had a Disparities and Outreach program that each year sees more than 60,000 people. And so what we found is that underserved populations tend to present with very advanced lung cancer. It's from lack of access to screening. So we had the idea of actually developing a mobile unit.
The typical patient that we serve with the lung bus are individuals who are without resources, uninsured, underinsured. They may live in an urban area, but the majority of who we serve, about 78%, live in rural areas where access to things like transportation, financial resource, and support are very slim.
This then also was targeting populations that we know have a higher smoking rate. Ultimately, with screening, we want to find cancer, but we want to find a cancer early. We've been able to find a good number of positive screens, and about 2.5% of our subjects were found to have a lung cancer. And I think most importantly about this is half of those people were able to be found with a very early lung cancer, so that way we can cure people and not just treat their symptoms.
This is a new technology that could change the way we think about screening for disease in underserved populations. You have to bring screening to them in order to be maximally successful. You have to work with the leadership of those communities to make sure that it works.
It really does feel like a small town community feel coming together. We can allow for walk-ups, and there's a lot of family members that are bringing their friends in or bringing their family members in, like they need to get this screening done.
The paradigm of the lung bus is being where people want to be. The paradigm of Levine Cancer is to be treating patients at home or close to home so that we can be where people need us.
And it really comes out of a philosophy that we have at Atrium Health, that we produce health, hope, and healing for all.
And to see that all of those bits and pieces have come together to detect cancer early in a population that would never, ever get this testing, it's just a huge reward, and hopefully will translate into other communities trying to do the same thing for their patients.